So, welcome to the Board of Health meeting, Wednesday, August 21st, from 5 to 7 p.m. I have to read this every time, pursuant to Chapter 2 of the Acts of 2023, an act relative to extending certain COVID-19 measures adopted during the state of emergency, signed into law on March 29, 2023. This meeting will be conducted via remote means and in person, as long as members of the public can easily access the proceedings in real time and participate remotely. Until further notice, this meeting will no longer be broadcast live, but it is recorded for later viewing. Members of the public who wish to participate in the meeting may do so in the following manner: in person at the Royal Park Meeting Room located on the second floor at Plymouth Town Hall, 26 Court Street, Plymouth, Mass. No occupancy limit of the room reduce the number of attendees that can be accommodated. For remote access, just use the login and the meeting ID and the password, which is on the agenda. You may also send any comment or question that pertains to a current agenda item to publichealth@plymouth-ma.gov. They'll be read on the air. Well, not on the air anymore. They will be read during the meeting and answered by the Board of Health as practicable. If the time doesn't permit answers during the meeting, responses will be sent by email as soon as possible. So our first, hopefully quick item of business is approve the minutes from the 24th of July. Does any board member have changes, corrections to those minutes? No? No? Meg?
No.
Lorenzo, any changes to those?
No.
And I just need a member of the board to make a motion to approve the minutes from the meeting of the 24th of July.
I so moved.
The motion made by Dr. Reed. Is there a second?
I'll second that.
Amy seconds the motion. If there's no further discussion, I just need to call the roll. So for this meeting, the only individual members present are myself, Dr. Reed, Lorenzo, and Meg. So that means, Amy, I guess you were absent.
I was, but I can vote to accept them, assuming that so if I vote to approve the meeting minutes, I'm basically voting to say that I have faith that the person did them correctly.
Okay. I'm sure that's appreciated. So Dr. Reed, yes or no?
Yes.
Lorenzo, yes or no?
Yes.
Meg?
Yes.
Amy?
Yes.
Myself, yes, it's unanimous. So the minutes are approved. The next item of business is going to be a variance request for 131G Taylor Avenue, GC Engineering.
Can I take it?
Yeah, please do, because otherwise our old device cannot find you.
Good evening. Sam Melly with JC Engineering. The subject property here is 131G Taylor Ave. This project involves upgrading an existing septic system, which is an existing septic tank and leaching pit with a new Title V septic system. The work involved in this project will be removing the existing tank and leaching pit and installing 2 new plastic septic tanks in series, a distribution box, as well as a new leaching field. Given the location of this site and the surrounding resource areas, we felt it was crucial to site the system at the furthest point on the lot away from the Cape Cod Bay, as well as the highest elevation on the property. With this, we are requesting relief from a handful of setback requirements to make this possible. These variances we are requesting include setbacks from the septic tanks to the front property line, as well as from the septic tanks to the cellar wall. Additionally, same thing with the leaching field, we will need a setback variance from the side property line as well as the cellar wall property. Additionally, a geomembrane liner will be around the majority of the perimeter of the leaching field. With that, I'd be happy to answer any questions the board may have.
Thank you. So Karen, did you have anything that you would like to add in terms of our previous discussion about buoyancy calculation?
We had a conversation about the buoyancy,
Okay.
and there was no water, right? Yeah,
Correct. Yeah, we had done test holes on the site,
Yeah.
and did not encounter groundwater to a depth like 3.5 feet below the bottom of these tanks, so. Which is why we
there's
did-
no buoyancy if there's no water.
We're always concerned about, possible inundation of the area because of increased sea levels and tidal surge.
But that's not, you can't measure that.
And I know,
So they would have had to have done it if they found water, because then there's water there. But because they didn't find water, there's really nothing to be measured.
And at that point, you'd probably have, the tanks would be full, so they would be, have some weight, more weight to them.
it's just concerning because we've seen pictures of septic tanks starting to float after the area was flooded.
Right, and we did look at that scenario too, and like I said, the tanks are almost always full of water. And they're 2.5 feet below grade, so for the buoyancy to overcome the downward forces, the tanks would have to be completely submerged in water and.
Something's gone horribly wrong.
Yeah. We have bigger problems than the septic tank on Taylor Ave in Down County.
As in, everybody better leave.
Yeah. There's been a tsunami, and we're all in trouble.
Okay, does any board member have any other questions? I'll just call everybody one at a time. Meg, do you have any questions?
No.
Dr. Reed?
No.
Amy?
Yeah.
Lorenzo?
No questions, but a clarification, if you can. So there used to be a leaching pit. What's the difference between leaching and cesspool?
So leaching pits often used when there's a tank prior to the pit. Cesspool is when, the sewage would exit the building directly into a pit. So kind of the presence of a tank, a septic tank.
So this is basically an upgrade. You're going from a leaching pit to now a septic tank.
A Title V system, yeah, septic tank, leaching field. Mhm.
Thank you.
Okay.
Was for my
Um,
own edification.
Yeah. We're still learning, although Title V is a huge amount of information.
Right, yeah.
Steve would know, he's helped us with that over the years. So is there any other comments or is there a recommendation from the
The
department?
department would recommend.
Okay. Okay, so in that case, I just need a member of the board to make a motion to approve the variance requests.
I'll make the motion to approve the variance requests.
Okay, Amy makes the motion. Is there a second?
Second.
Dr. Reed seconds the motion. Any further discussion? Are there any abutters involved? I didn't notice.
There aren't,
There aren't.
no.
So if there's no abutters present, they were all notified, I assume.
They were, yes.
Okay.
Is anyone here?
No, but I'm part of this kind of, but they all receive letters, yeah.
Oh, okay. Okay.
Okay, so if there's no abutter comments and there's no further questions and the motion has been made and seconded, I'll just call the roll once again. So Dr. Reed, yes or no?
Yes.
Amy, yes or no?
Yes.
Lorenzo, yes or no?
Yes.
Meg, yes or no?
Yes.
Myself, yes, it's unanimous.
Thank you.
Thank you.
Have a good evening.
You as well.
Thank you.
The next variance request is from, Stephen Nelson for 36 Provincetown View Road.
Provincetown View Road. Hello, everybody, I'm Steve Nelson. Registered sanitarian. We have a small lot, a 4,300 square foot lot on the corner of Minute Beach Boulevard and Provincetown View Road. And they have an existing cesspool on about 5 feet from the back lot line, which we propose to remove and install a new 1,500 gallon septic tank. That's 5 foot off the 5 foot lot line meant I had to notify the neighbor on Minute Beach Boulevard. We had just enough room for a leaching chamber type trench in the existing dirt drive area, which had to be 5 feet off the lot line from number 40 Provincetown View Road. We're 14 feet from the house, but the house is on a crawl space. So I asked for the 10 feet, a little less than 10 feet, or 20 feet, but I'm 14, so from a crawl space, so I'm not sure if that's even done. But other than that, the soils were all nice, medium to coarse sand, very good perk rate. This is far superior to what was there. When we looked into it, it's one of the old fieldstone cesspools and halfway collapsed. And
Excuse me while I grimace.
I know, yeah. I sent notification to the two neighbors and I got one green card back from the neighbor at Minute Beach Boulevard. And I received a phone call yesterday from the fellow who owns 40 Provincetown View. He was unable to get out of the house to get the green card. He tracked us down.
Wow.
By the phone number and the information on the plan, so he tracked us down. And he said, I thought it was a bill. I said, no. It's just a septic system, and he was happy to get that. So, there were no complaints for the neighbors. We're at elevation, I heard the buoyancy thing get mentioned. We're at elevation 71. And we're on the further side, the other side of the road from the coastal bank. So we're a good 130, 140 feet from the coastal bank, top of the coastal bank. So we didn't run into any notification to Concom or anything. And so that's what we have. Pretty simple thing. It's just a little bit of a tight squeeze.
As always. Just about.
That apparently is my specialty. I'm not sure.
Okay, thanks, Steve. Any comments from the department?
The department would recommend, it's an exceptionally small lot, so I think what Steve was actually able to do is pretty amazing. And with the neighbors being notified that he's meet all the criteria that we would have asked.
Okay. Does any board member have questions for Steve? No. Lorenzo,
No,
I think I saw you shaking your head in your little box there. Meg?
No questions.
Okay, no questions for me either. If there's no further discussion, I'll just ask for a motion.
I'll make a motion to accept the plan as written.
Okay, Amy makes the motion. Is there a second? Dr. Reed makes the second. If there's no further comments or discussion, I'll just call the roll. Dr. Reed, yes or no?
Yes.
Amy, yes or no?
Yes.
Lorenzo, yes or no?
yes,
Meg, yes or no?
Yes.
Myself, yes, it's unanimous.
Okay, terrific.
Thank you.
Okay.
If you want to pass that down to.
That'd be great.
the
Thank
channel,
you.
That's terrific. Thank you very much.
Thank you.
You're welcome.
We'll see if we can find a small lot like
Yeah.
that.
Maybe you could find a little bigger one.
I'd like to, yeah.
Are you still installing some of the newer septic systems?
Oh, yeah. Yeah, we're starting to see more and more of those now. And on the Cape, so we're doing some nitrogen testing on the jet system also, so
Mhm.
it's become a good alternative for the really small lots.
We welcome the new systems and we especially welcome getting rid of cesspools.
Especially, okay, thank you very much.
Thanks, Steve.
Okay, the next item is I'm gonna require a screen share, but I think I have mastered the process. Here it is. And if I can just get to. Good. I did it. So, as some of you may have heard, there has been a significant surge in COVID cases this summer. It also happened the previous summer. The surge this summer is a little bit worse. And as you can see from this graphic, that's provided by the CDC, there is, quite a lot of increased COVID infections throughout the country. In New England, the only two states that are experiencing this at the point where it's actually growing are the Commonwealth of Massachusetts and Rhode Island. The rest, it's likely growing, but it doesn't seem to be as obvious. The rest of the states are either stable, which is only 4 of them, 5 of them, including the Hawaiian Islands, or as you can see from the other colorations, there's some that are not estimated. So if you look at what's going on with these, which is actually a map of wastewater monitoring in the US, the Commonwealth of Massachusetts is actually in the moderate range, which is a lot better than most of the rest of the country. As you can see, there's some exceptions, but there's still quite a lot of viruses being found in the wastewater throughout the country. This shows you what's going on in Massachusetts with the wastewater monitoring. And this is for the Boston treatment plant. So there's both the southern and the northern input coming into this treatment plant. And it's pretty obvious if you just look at that little red peak way over on the right, which is for pretty much current for August, that there is a peak. It's small, but if you look over at the similar date way over in 2023, you can see that there was a little bit of a peak, but this time it's worse. If you look back a little ways at January during the winter, you can see a fairly significant troubling peak that occurred last winter. It's expected that that will happen again. This is from Massachusetts to show you what happens over the course of a year. So again, you can see this large peak that occurred during the winter. And then there's smaller peaks over on the far right-hand side, which is the current peaks that are being observed. There's also on here lines indicating the national trends and also the trends for our Northeast regional area. And you can see that around the Massachusetts area, the peak was higher than it was for the rest of the Northeast region, but it's now dropped. I don't know if we have another one yet. This will show you what's going on more recently. So you can see that, yes, there was a pretty big peak in Massachusetts, but now it's dropped so that it's actually fallen below the level of viruses found in the wastewater, both nationwide and most recently in the rest of the region as well. So bottom line is it's still there. This is the cases of COVID that have been found by 7-day reporting. And you can see, again, way over on the right is what's going on right now. There's this kind of a medium-sized peak, nothing like we saw in the winter. If you look further to the left, you see what happened last summer in terms of cases. And it looks like it may develop into about the same, or maybe a little less this year. So what's going on? This is something I usually hope I don't have to say, but COVID-19 is not done with us. The wastewater surveillance shows that COVID infections are still creeping up. Recent analysis suggests the rise is driven in part by a new variant called FLIRT. And believe me, FLIRT does not have anything to do with our interacting with other people.
Supposed to make us feel better.
I know.
Oh, right.
It is the nickname for a family of variants. They include something called KP2, which is the one that's causing most of the cases in Massachusetts, and KP3. They're all daughters or sons of JN1, which came from one called BA 286. And last fall, that one got a lot of attention because it actually carried three new mutations. And it was circulated widely. The flirt variants are characterized by changes at three positions in a little spike protein, which is like grappling hooks that latches onto the cells. The virus uses to bind them to the cells. And the name is an acronym derived from the technical name of the location where the mutations are located on the protein. So flirt has nothing to do with flirting. So what are you gonna do about this? Well, infectious disease experts advise those who are older, who have multiple medical conditions or immunocompromised to make sure they're up to date on vaccines. Although we're in the middle of COVID fatigue, nobody wants to hear about this anymore. It's also become endemic. And many Americans are no longer getting tested or testing themselves for COVID because their symptoms aren't too bad. It makes it even more important than ever that most vulnerable people protect themselves. Not only by making sure their vaccine is up to date, but also by wearing masks if they're out with other people. So the new COVID vaccines, the last one that was new came about last fall. The CDC recommended additional doses for adults 65 and older, and they recommended that in February. So being a person that walks the walk and doesn't just talk the talk, I went and got my vaccine in the spring. And it was also very important that I did because we went on a trip to Europe and we were both infected, but my infection was barely noticeable. Unfortunately, my wife's infection was more than noticeable when we got home. And we did test because we still had test kits. I don't believe it's easy to get test kits anymore. Did the department order any new ones at all?
No, the only ones that the state have will be expired in less than 30 days.
So it's difficult to get test kits more than it used to be. And if you can find them, I guess there's a charge for them
We do have a few left, right? We do have some in the office.
that haven't expired.
They are expired.
Oh, they are expired.
But people are still taking them. We tell them that they're expired. We had someone who was positive for COVID and we asked them to take a test and then turned out to be positive for COVID, so.
Yeah.
I did that when my son had COVID. I made him use expired test kits just to see, cause he used one that was legitimate.
Yeah.
It showed he was positive and I kept having him test just to see. And he kept testing positive, so.
Yes, we tell them
Yeah.
that it's
You
expired,
can,
but.
yeah, you can believe a positive, but you can't believe a negative.
Right.
Yeah.
Right.
Also, what happens is we knew who we were infected by in Europe. Because this woman was sitting with us at a breakfast table. Didn't know, but she asked if she could sit with us, and we said, sure, and then she proceeded to cough and sneeze. And I probably made a face and she said, oh, but I already tested and I'm negative.
Mm,
Except
mm,
if you test right after you show symptoms, you
Mhm.
often will show negative.
mhm.
But if you test again about 2 days later, it'll probably show you're positive. And that's exactly what had happened. When I tested myself, I got home, the positive bar was almost invisible.
Mhm.
But the one on my wife's test popped up real bright and strong within, I don't know, a minute or two. And she had some pretty bad symptoms from it. So in terms of what they're gonna do now, they are hoping, and it's on here, they're hoping to produce new vaccines for the fall that are gonna be targeted, hopefully towards this KP2 strain. And the reason the KP2 is a problem is it has become much more able to bind to the cells and cause infection, so it's more infectious. It's difficult to avoid it if you're exposed. And that's why the vaccines are so critically important. And, you know, as soon as they come about, available in the fall and winter, they recommend that although you're supposed to get the influenza vaccine maybe in September, October, the COVID vaccine, you should probably get as early as you possibly can once they become available. So that's all I wanted to say about that. Gonna skip this for a moment, just to tell you what's going on with tick-borne diseases. So it's a bad summer for ticks. There's a lot of ticks. It's probably because it's been quite hot, it's been quite wet on and off. Ticks love it. And they're present in huge numbers, probably more than we've seen, I think, for a long time. For those that are interested in the latest tick information, Blake Dinius from the county control mosquito control office will be here at our next meeting and will give a presentation about all the tick-borne illnesses and what you can do about them and how you should avoid getting those kind of diseases. It basically comes down to things that people don't want to do in the summer.
Okay.
They don't want to wear long sleeves. They don't want to wear long pants. A lot of people want to wear sandals. And unless you treat exposed skin with an effective insect repellent, you are probably going to have a difficult time avoiding getting bitten by ticks. And I just pulled this up because this came from our epidemiologist report, who will also be here next time to give us a lot of information from her newly designed public health profile for the town of Plymouth. It's immense. I mean, it's huge. She prepared a report that I think is 60-something pages
I think it's
long.
75.
So she'll be called upon to summarize.
Yes.
Tremendously.
Yes.
She's doing the same thing for the other communities that are part of our public health excellence grant. She did Plymouth first, and I just wanted to mention that in terms of communicable diseases, according to the Maven reporting system, Lyme disease was number 3 with 299 cases during the past year, up until June 1st. Worse than that was influenza with 657 cases, and worse still was the coronavirus with 1,879 cases. Down the list a little bit, there's something called babesiosis. It's also a tick-borne disease. I know a lot about it because my next across the street neighbor disappeared for weeks, hadn't seen him. Finally saw him and I said, "What happened to you?" And he said, "I was bitten by a tick." And I went to the hospital and they didn't know what I had, and I was really, really sick. And I was anemic and I was tired all the time. And they finally sent me to South Coast Hospital. And the doctors there did a whole bunch of tests, and then they finally said, "You've got babesiosis." And what happens in babesiosis is, you probably know, Dr. Reed, the infectious agent carried by the tick actually infects the red blood cells. And they burst or hemolyze in tremendous numbers. And so the doctor who treated him said, "You're lucky we figured this out and you came in fairly quickly, because in another week you would have died."
Wow.
Period. So he is still recovering, and he's had some neurological damage from it as well. One of his feet doesn't move right anymore, and it just kind of flops around when he's trying to walk. So it's a pretty serious disease.
How many cases do we?
In the 12 months from June 1 of 2023 to this past June 1, there was 51 cases in Plymouth.
Wow.
And
Just so that people know, it's more common on Martha's Vineyard and Nantucket. So if you're vacationing there and you get bit by a tick and you get tested, you should tell the doctor where you've been,
yeah,
because and they put a test for
yeah, they do. And it is treatable.
Yeah.
You can treat it with a variety. He got a cocktail of antibiotics,
Yeah.
some of which he had to get IV in the hospital. So he was scared to death.
Yeah, of course.
Yeah, please.
Is there any rodent-borne diseases on that list that you have?
I'm sure there are, but I was just looking down the list quickly.
It's not that one.
Leptospirosis. I thought I saw that, but. No, I don't see it listed. But it will be a subject of discussion, at our next meeting. Because, and as a matter of fact, it'll be discussed somewhat as soon as we get past this and we start going into the, pest management rat control part of the meeting. Because it's contained there too. So if anybody has any questions about this, I mean, there isn't any new news. You know what to do. You have to avoid also, if you possibly can, being in high grass areas. And do not, if you can possibly help it, just brush against shrubs or bushes or plants. Because the ticks tend to hang off of them about a foot or two high off the ground. And if you happen to rub against them, they will immediately attach to you and switch to you instead of being on the plant. Also, be very careful if you have animals and you take them outside for walks, because the ticks will obviously attach to your dogs as well. So it's a troubling problem. It's not getting better, that's for sure. Hopefully they'll eventually come up with some kind of vaccine that will partially protect against some of these diseases. So the next, if there's no questions about that or comments. So warnings have been dispensed. The next thing is, it's really not a warning, but it is a response to a lot of people that have come to a public forum we had back in May. About rat control methods and their concern about the use of something called secondary SGARs, which are toxins that are used to poison the rats and it kills them by interfering with blood clotting. So these are some of the things I've seen lately about this. And we've been in contact with the head of Plymouth's DPW. And they are working also on this at the same time, and they are developing an integrated pest management program. And I already saw a draft of it. And we sent them the draft of what I prepared for the Board of Health to act on. And a lot of what was in what I prepared for you to vote on, which now we don't have to vote on, is actually been incorporated into the town's integrated pest management.
Oh, okay.
Oh, good.
We can't vote on that yet today, because it hasn't been finalized. And, the DPW director still hasn't officially approved and signed off on it. But integrated pest management is the way to go, apparently. Why this came up? If you look at this particular slide, it may be a little hard to read, so I'll read it to you. This was published on September 14th on, Patch. And they apparently had a urban rodentologist. I don't know what kind of degree you have to get to be a rodentologist, but that's beside the point. He said that rat populations in the country are up 15 to 35% in recent years, and current pest control guidelines are not enough. What's happening is that the pest control company comes in and puts out black boxes which are locked, and they contain these poisons. And then they say we're exterminating the rats on the site. But unfortunately, according to him at least, what's happening is that it's not really effective, because only rats that consume the poison are affected, and they are often quickly replaced by other rats, because rats breed very, very quickly. So that was the start of this. This is, I sent it to all the board members. I hope you had time to look through it. This is what I was planning on doing, which is a Board of Health policy on the prohibition of the use of second generation anticoagulant rodenticides on town property. But as I looked through other towns, I found 3 that had done this. And they all did the same thing, which is, they said that on town-owned property, these poisons shall not be used as a primary means of control. And that they, could only be used when there is a really serious infestation. And other methods have been tried and have not been effective. And in the case of Plymouth, it is going to require the pest control companies to actually submit a written request to the department and the Board of Health to use these compounds, again, if there is no alternative to control the severe infestations of rats. So obviously I can't show you the whole thing because it goes on for pages, but I wanted to get some comments from board members and also from members of the public. So I'll ask the board members first and then I'll get to you. I want to see what they have to say about this. Amy?
Yeah, I support it. I feel like there's, I feel like that's the way to go is they can cause the harm, you know, with integrated pest management being the goal, the gold standard. I think by, allowing, approval from the department is important to have that in the, you know, as an option. But I would feel most comfortable to prevent it without the approval of the department.
Okay. Dr. Reed?
Under which umbrella does the integrated pest control fall?
It would be DPW.
Department of Public Works, working with, Carl Anderson, who is the facilities director. So
Okay,
he's in charge of all the buildings that we have in Plymouth.
okay.
Not only buildings, but I assume all public properties as well,
Mhm.
parks, playgrounds.
Right, but there are other people, like Nick Fiella is the director of the parks.
Yeah.
You know what I mean? So, there's different players involved, but,
And you've seen what they've written?
I have quickly seen, because I just got it this afternoon, I did look through it, and there was an awful lot of what's in our proposed policy that they have incorporated. They also are going to attach something from one of the pest control companies, forget his name. The guy who does the town pest control.
Dan, right behind
So they.
right here,
The guy who does.
It's a guy who.
Right there.
So he did receive, you know, a fairly, a comprehensive, sort of written thing from you. And he was planning, as far as I know, to attach that to the town IPM policy as well. So yes, it was looked at carefully. I will show you, you know, a little further down. You know, we took into consideration what everyone said, and there was an awful lot of people here who are really concerned about, you know, non-targeted species. And because of that, and because of what they did in the only towns in the Commonwealth, which is, I think, Brookline and Newbury and Arlington were the only ones I could find that did something like this. And again, it's restricted to town-owned property. And why it's restricted to town-owned property is because these are the laws. Federal government regulates pesticides through a federal law called the Federal Insecticide, Fungicide, and Rodenticide Act. It gives Environmental Protection Agency the power to register and regulate pesticides. Under the federal law, they pass the buck and they give control for primary enforcement to the states. In Massachusetts, that's done and regulated through the Massachusetts Pesticide Control Act, which is one of the general laws. And it gives the power to control these pesticides to the Massachusetts Department of Agriculture and Resources, but the structure prevents local municipalities from enforcement powers and the ability to set stricter standards. So the exception is, of course, town-owned properties don't get blocked by this preemption law. In terms of public health danger from rats, because somebody asked about this, rats are carriers of a lot of diseases that are very harmful, including leptospirosis, hantavirus, rat bite fever, toxoplasmosis, fungus causing ringworm, and worst of all, historically, the bubonic or black plague. The last one was caused, everyone probably knows from history, especially if you have public health background. That it was transmitted as the Black Plague caused tremendous numbers of deaths, and it was transmitted via the fleas that were present on the rats. The other diseases, other diseases like it are transmitted by direct or indirect contact with rat urine, rat feces, or even rat nesting materials. So, that's why in the event that you happen to find dead rats or rodents in your yard, you must be extremely cautious and wear gloves when you're handling them. And if you know that there has been rat urine or rat feces or nesting materials on your property, it's recommended that you treat it with bleach solution, which apparently will kill the infectious agents. You can also get salmonellosis and lymphocytic choriomeningitis. Neither of which would be much fun, I'm sure. So the applicability here. I know you're itching to talk. I'm gonna let you in a minute. We have to apply this only to town-owned buildings, grounds, parks, open spaces, and public rights of way. And it will have to be followed by employees of all the town of Plymouth, as well as third-party vendors and contractors providing services in around town-owned properties. There's some definitions we have to go through. This is what the prohibition states. The use of SGARs on all exteriors of buildings of town-owned property is prohibited except in the case of extensive rodent infestations that have been deemed to be uncontrollable by other methods that are less environmentally harmful. This is what you do for a waiver. Waivers for the use of these poisons on town-owned properties may be obtained from the Department of Public Health or Board of Health. Waivers shall be restricted in time and location, shall only be granted after well-documented written request detailing a significant rodent infestation of public health consequence that has already failed to be mitigated by other less toxic integrated pest and rodent management practices. And the written pre-notification lists some things which need to be included. Name and phone number of the company, previous control methods employed, proposed date of application, locations to be treated, and the names, EPA registration numbers, and active ingredients for the pesticide products that will be used.
Very good.
Now.
Yeah. Can you go back to, just for clarification for the page before? So the use of the SGARs on all exteriors of the buildings, would it be allowed interior buildings? Like according to this, I just noticed that you said exterior, but.
Yeah, I think that the wording of that may be slightly different in the integrated pest management, that is being developed by the DPW. But I did it on the exterior building simply because if they're on interior surfaces, unless the animals get into the traps and consume the poison and then get back out of the building,
Yeah, I thought that was the issue.
they will therefore, if they're dying within the building, they will not be picked up by owls and hawks and
Right,
other, birds of prey. That might then transmit it back to the nest and kill off their baby birds.
right.
And they also wouldn't be able to, you wouldn't have to worry about dogs or other pets getting, into it as well. So, yeah, that's why that was there.
Yeah, I would personally feel more comfortable if it was on any, like interior or exterior.
Well, that, I can't,
Yeah, we can talk about that
I
later.
was sworn to secrecy by the DPW.
Okay, that's fine, we can talk, I
It should not be made public at this time because it has not been finalized or signed off on. So, yes, sir.
I'm saying from a board of health perspective, I would feel more comfortable on if this was something that the board was passing, separate from the DPW, I would want it to be on interior or exterior.
Well, I think at this point, we have to wait and see what the final
Yeah.
version that comes out of the
Sounds good.
DPW does. Because if they're doing it and they're incorporating some of our wording from this into their, integrated pest management policy, then there is no point in us taking a formal vote on this because
Mhm.
Some of it's gonna be in and some of it's not. So. That's all I wanted to say. There's a definition of integrated pest management here, which I'm sure you know all about it. But for those who don't, it's an environmentally friendly, common sense approach to pest control. It focuses on pest prevention through sanitation and exclusion, only using pesticides as needed to reduce pest populations. So the Board of Health and the Public Health Department recommends that we follow this with an IPM approach by working with the DPW to develop it. Obviously, none of this is gonna apply to private properties, because it cannot legally do so. Now, sorry to make you wait.
Sure.
Yeah, you probably should come up and
Yeah,
sit here
so
because
we can hear you.
the owl device would like to personally record you.
Dan Forend, I'm actually a taxpayer in the town of Carver, I just wanted to share my 2 cents as a taxpayer. I real quickly, this is the first time I've seen it, scanned over what you had proposed there, and I don't really see anything at all referenced or mentioned from the very large number of business owners in the town of Plymouth, very large number of industry experts that came to those meetings. Again, just off a quick 3 slides that I referenced, initial reaction is it seems like we might have wasted our time by coming in as industry professionals to share our opinion when it doesn't seem like it was at all referenced in
Well,
any one of those 3 things.
that's why there are waivers, because of what you stated at the meeting, at the public forum.
So, related to these waivers, rats are at a particular property that might abut private property that's owned by the town. How quickly, will one of these waivers be able to be granted? Is it gonna be something that's gonna have to go to a Board of Health meeting?
Well, that's why we also reference the department.
Yeah.
Because these kinds of things require immediate action. We don't wanna wait around and let the rats further multiply and spread. So what would probably happen is if you sent this into the department, I assume the department would possibly consult myself as the chair and then would issue a waiver.
Yeah, here's an example. South Elementary.
Hmm.
The number that we had there, you'd automatically get a waiver. There'd be no discussion. There's nothing else that could have happened there except that, especially with children involved and there'd be nothing else to discuss.
Okay.
And again, this is just for town-owned buildings.
Mhm.
You know, your private customers, you're still gonna be doing.
I understand, I just would be concerned about, Town Wharf as an example, there is a very large number of, private well, depending on how you look at it, private property that
Yeah,
rents from the town
rents.
that,
Mhm.
I don't know what kind of precedent this is setting for, renters in the town of Plymouth, as well as business private property owners that when the town of Plymouth next door might be a source of rats that are impacting their business, there's a special process to solve that, but.
But that
It
would be,
just
that would
seems-
be part of, I mean. Pete, to be honest, Dan, you already do what we're gonna be asking you to do, cause
Yeah.
I've seen what you do,
Right.
do you know what I mean? So,
I got you.
so you're already doing what we're gonna ask you to do anyway, it's part of your own business plan.
Okay,
But in that particular case, that would be important to note when you come to the department to say, hey, guys, we got a situation here. These are the other buildings that are being impacted, and that's all part of that waiver
Okay.
process. So I mean, I don't want you to feel that I certainly listened. You know what I mean? I certainly did. I've done more research on rats than I ever wanted to do in my entire life.
yeah,
You know, it's interesting, like, we laugh, but it's true. I mean, we all went to school and I deal with the rats and poop.
Yeah.
You know what I mean? So but it's important.
Right.
Do you know what I mean? So I want you to know that our department has certainly done, you know, our research. And you know, you and I have spoke multiple times and I've given ample time to the other side too.
yeah,
I have not been secret in my opinion that 3 owls are not a public health issue.
okay,
They're not. The public health issue, the diseases that rats can bring. So that's what I have to concentrate on.
Okay, and then I just wanna share real quick, I won't take any more of your time, super quick, we, as an industry came in and we referenced a lot of bills that were, before the state
Mhm.
legislature.
Mhm.
For whatever reason, whether that was, their feeling on whether there was a significant issue to pass those, or whether they ran out of time. None of those restrictive bills against the use of rodenticide in any one of the towns in Massachusetts, made it out of committee and was voted on,
Yeah,
so
well,
nothing.
that would be for private property use also.
No, this was everything, so like the
Yeah,
town of
everything.
Arlington, there was a few towns you mentioned that tried to push certain things through, and those were all. Went nowhere this
Yeah.
legislative session, so.
That's because of the preemption clause, and the state legislature decided that they wanted to maintain the
Exactly.
preemption clause in the statute as it was.
Yeah.
Yes, when things go before committees in the state legislature at the very end of a 2-year legislative session, a lot of stuff dies.
Right.
Yeah, a lot of public health stuff died.
Yeah.
But, you know,
I appreciate that.
be assured that we're trying, as I mentioned, try to find some kind of middle ground.
Mhm.
So that's why, I mean, I spent days and days and days doing this. I wanted to, you know, give the people who were environmentally concerned something. And I wanted to, at the same time, not interfere with the pest control companies doing what has to be done.
Right.
And
I
I hope,
appreciate your time. Thank you.
I hoped that this would accomplish that.
Yeah, thank you very much.
Thanks, Dan.
And so, for those who want to know more about, integrated pest management practice, there's a lot of less toxic measures than poisons that can be used, and I think a lot of this is on the department website. Removing attractants such as food, water, and harborage areas from the property. Could involve removing bird feeders, unsecured garbage, and composting containers. Every time I see a container of trash, that's overflowing, and the top is not even closed, and it's full of plastic bag trash, I get really worried. And by the way, I promised that I would mention to you one particular restaurant, which I'll do privately afterwards, because I don't want to name them in public, whose trash bins are a disgrace and are not being properly maintained. We dealt with that previously with one of the restaurants in town as well, but apparently there's another one. So you also got to look out for leaving out pet water, unattended pet food and water, leaf piles or overgrown vegetation, which we talked about previously, because it provides harborage areas. So you have to keep, items away from foundation and walls, helps to eliminate the runways for the rodents. And we found out lately that since rodents like to get running through an area which has cover, so they're not easily seen, it's important that shrubs and bushes be trimmed so that they're 1 to 2 feet off the ground. And I hope this made it back to the DPW. Because obviously it's needed. In terms of other things that they can be done, I mean, you can tell us if you do any of these. There's electrical traps, there's snap traps. I assume you use some of them.
So that CO2 trap that I brought in the
Mhm.
meeting, I've tried that at my own property and it is completely unsuccessful, so.
Did you try carbon monoxide treatment?
I have tried that, yes, when you have a big colony, it works, so someplace that's, you know, lots of burrows. But if you got burrows on adjacent property and the rats are coming over. You run into an issue where you can't
Okay.
go on that property to use the CO2.
We also recently found out about rat fertility control. And I think Karen got a thing from a company that manufactures something called Evolve. Are you familiar with that stuff?
Yes.
Apparently, I don't know how effective it is. There's a lot of going back and forth about whether it works or whether it doesn't work.
I believe both sides of the meeting, said that that would be a viable option.
Yeah, well, apparently it uses cottonseed oil, which is what actually, you know, blocks, fertility in both the male and the female rats, but it takes a while. And they claim that you don't see much of an effect until 1 to 2 breeding cycles, which is about 4 to 6 weeks after it's initially put down. But it doesn't cause any harm to human health or the environment, and it doesn't harm non-target species, including predatory birds. Bigger mammals, which include pets, would have to ingest a large amount of this stuff, and the stuff is commercially available. I assume anybody can buy the stuff. I think you can buy it on Amazon. The problem is that the woman that was testing this in Jamaica Plain, and I guess they made it themselves. I don't think it was Evolved, but it was something very similar. Said that she had to replace the pellets on a daily basis because apparently the pellets contain all the nutritional requirements for the rats, and so it's a very attractive food. And she had to replace it by going to the boxes that contained it and giving it a kick. Because most of the time when she kicked the box, a rat or two came out. And then she would open it up and replace the pellets and put it back again. So this is something that I would hope pest control companies would look into. I don't know how expensive it is. Obviously, private owners could utilize this stuff too, but I don't think it would be wise to put it out without putting it into a container that would restrict access to it. Do you agree?
So my only concern about that whole entire subject was you mentioned 4 to 6 weeks, so 4 to 6 weeks while you're. Rolling this out, rats are continuing to defecate, urinate and cause damage to structures is. My
Well,
initial reaction to something like.
My reaction to your suggestion would be, well, if that's the case. And there's a really bad infestation and things like, snap traps and carbon monoxide and the stuff haven't worked. Well, why not use both? SGARs for immediate relief, although it won't be effective necessarily to get rid of them forever. And, using this stuff to actually reduce the population over a longer period of time. I assume that would add some to the cost of the treatments. Has to. But if it would be effective and even more effective possibly than just relying only on SGAR, maybe it's worthwhile exploring. So was hoping that would be something that, the pest control companies would think about when they start looking at what are we gonna do?
I think at that meeting, both the pest control companies as well as the non-rodenticide group had spoken against fertility treatments at length. That they've proven not to work. And it would have to be on such a large scale that, like towns, state, large.
Yeah. Because as you said, rats do move around a lot.
Yeah.
And so, if this stuff is allowed for private use on private properties, maybe it would be more effective, because I think the tests were only done under very limited conditions.
Yeah.
And I don't think they've been testing it for very long either. I don't know when the stuff was first marketed, but, it's something I didn't know about until we started researching this. I don't know if Karen knew about it before or not.
Well, New York tried it and it didn't work very well, and they went to dogs. Which is working very well.
Hmm.
Yep, which is actually working.
Yeah.
Yeah, and there are, I've been reading more and more articles that actually say that the one thing that a lot of groups are recommending is to learn to live with them. That just like we learn to live with other wild animals, that we need to learn to coexist with rats,
Yeah.
because they're not, no matter what we do, they're not going away. So I think the preventive measures are gonna become so important.
Yeah.
It's like you said, Dr. Poffin, the bird feeders, the trash. Bushes everywhere. We're never gonna get rid of them because we're on the water, first of all. That's always going to be, just anyone who has a harbor will tell you that from the dawn of time. But there are certainly things that people can do in their own spaces, and we also, require pest control when buildings are being torn down, because people say construction, their homes get disrupted and they have to scamper to find some other place. So in the department, anytime that there's any type of, you know, house torn down, building torn down, or whatever the situation is, any kind of demolishing, we require a pest control plan.
Yeah.
So that, you know, again, preemptive measures, so that there won't be a problem. As, you know, Dan had mentioned, you know, it's one thing to treat the town-owned building. You have to be careful that they just don't leave the town-owned building and go next door to the non-town-owned building. So, you know, it's more of a much wider, picture that we have to look at.
So the bottom line is that pest control companies can use both if they wish to, on both town-owned and private property. So, you know, hopefully, you know, you agree that we probably have, with working with the DPW, whatever they come up with in the end, will be something that the pest control companies will be not necessarily fully happy with, but, able to live with. And that
It seems as long as the waivers can be granted timely,
oh, yeah,
then I don't really see any changes or
yeah, I mean,
negative impacts for it.
we've had other instances, and that's why we routinely monitor, you know, the state Maven system for infectious diseases. Things pop up, and they have popped up even here in Plymouth, that require immediate, I mean, like that day.
Right.
Measures to be taken to control the infection. And so, you know, that doesn't necessarily involve the board of health, it involves more the department personnel.
Thank you.
Okay? So thanks for coming in, and I was impressed, I learned some stuff by reading what you sent over to DPW. So, no, I didn't know all this.
Excellent. Yeah, hopefully, everything blended together will make a good.
I think they have already started with the draft, and I think that, you know, they will come up with something that is as good as we can possibly get to. Which will still work. I hope. Okay, so,
We'll just have to make sure we can get authorization for our little Jack Russell Terrier to
Yes.
assist in that.
I think that'd be great.
Yeah, they're on, the videos are on YouTube, if you ever wanted to see them, I think they do it 2:30 in the morning or something like that, 3 o'clock in the morning, and everyone just lets them go, and they are so happy.
They are.
The little dogs are so, because that's what that's in them, that's their instinct,
Yeah.
and they're just so happy that they're doing it.
She didn't take long to know her instinct.
Yeah. Cats have the same instinct, but sometimes the rats are a little too big for them.
Do they bring them back to?
Yes,
It's not so much a bring back, it's more
they're
of
dead,
do it.
Well,
do it
I
right
know.
where it is, and then keep going for the next.
yeah.
And I'm sure
So
they're trained and
something
rewarded for their
else.
activities.
Good help, yeah.
Yes.
Okay, you'll just leave them
Yeah,
there.
so before you leave, let's make sure that no other board member, has any other questions or information we'd like to gather while you're here.
Okay, thank you.
You're good? Okay, Meg,
No questions?
no rat questions?
No.
Lorenzo, do you have anything you want to bring up?
Through the chair, no rat questions, but I just did want to make a comment that, you know, the forum that we did have, you know, just made me sensitive to the adverse effects to some as you mentioned, non-targeted species. And then I think advocating for IPM is the right way to go. And I think with looking at what you've developed here, you've given exceptions, right? There's a process, due process to have waivers put in place. So I think that there's like you said, Dr. Potton, good middle ground here. And so we just wait for what DPW has, and we'll go from there. Thank you.
Yeah, I think the whole point is, hopefully the SJRs will not be the first line of defense, no matter how many rats there's a problem with. Yeah, and if it's overrun like it was at the school, that's a whole different world. We can't wait for that. That's gotta have instantaneous treatment.
Yeah, we want it to still be a tool in the toolbox. We don't necessarily want it to be the first tool that pest control companies go for.
Yeah.
So,
Okay, so thanks a lot. We appreciate your help, and And hopefully the people that came in large numbers, the environmental people will
Yeah.
say, well, this isn't what we hoped for, but. You know.
Appreciate your time, thank you.
Thanks so much.
So the next thing is fairly quick, the public comment policy. Karen found this, I'd totally forgotten about it. It was something that was done, I guess, what, 2 years ago
I think so, yeah.
about, but we never actually took a vote on it. And since that happened, it's fortunate that this came up again, because those of us who have been to MAHB annual meetings have heard over and over and over again that there are things that you wish you could do to control public comments at meetings, but legally, you can't. So to cover my bases, I contacted Cheryl Sabara at MHB. She was on vacation because
Oh my goodness.
I sent this to her like the day after she went on vacation. And I hadn't gotten a response, so this afternoon I called her and I said, Cheryl, we have to talk about this at the meeting. Would you check this to make sure it conforms to, you know, the legal decisions that have been made? And she said, yes, it does, with one exception. And the exception is down here. Going too far. Under number 7. Disruptive behavior will not be tolerated. Examples of disruptive behavior include interrupting the board or another speaker, speaking when not recognized by the board chair, speaking on a matter not before the board. The next one is the one she said we cannot do. We cannot do anything about anyone who engages in personal attacks on any person or entity. It's banned by a decision of the courts, free speech rights. E is okay, speaking to others while the meeting is still proceeding, including upon entering or leaving the meeting, which we have all seen happening, a lot.
Yeah.
And basically, when people do that, or they don't think that they're causing a problem, you have to suspend the meeting because you cannot listen to each other when 50 people are having private conversations. Because what they came for is already over with. And rather than leaving the room, they stand around in the back of the room and talk. So what can be done, is that, I guess down here, back. What can be done, as you can see here, is must be up here someplace. What can be done, I forget which number it's under, but, if someone is being disruptive, and we've seen this happen, there was one town select board group, that apparently there were so many people from 2 different opposing sides that came to the meeting. They would not stop talking. And eventually, the select board in this town decided that they had no choice, they're gonna have to go to a fully remote meeting. Period. And so there is no more chance of that happening. What we can do, and it's here someplace, I don't know if I can find it quickly, yeah, it should be down around the bell. A person who engages in disruptive behavior will be warned by the Board of Health Chair. If further disruptive behavior occurs, the Board of Health Chair may temporarily suspend the meeting or ask the Board of Health to vote on a motion to adjourn. And so what has happened in other towns, is that when things get out of control, the board members get up and leave the room. And they go off someplace and they stay hidden for a certain period of time. And then apparently they send someone down to see if the people who were causing the disruptions had given up and left. And if they did, the meeting resumes. And if they didn't, and they're still there, they would simply return and say, well, since there's still a problem here, so I'm gonna ask a board member to make a motion to formally adjourn to another date. And then everybody leaves and the meeting ends. That's perfectly legal to do. We haven't been in a situation like that. I don't think as yet, although we have had instances where people simply would not stop talking. Warned, over and over and over again. When our meetings were being conducted, remotely. The solution was, and it wouldn't be legal anymore, I don't think, to simply push the mute button. But I don't think we can do that anymore.
That's actually in here. It says, you also have the meeting conduct and procedures too,
That's a separate thing.
okay? Cause that actually talks about it in that,
Yeah, Cheryl Sabaro did not yet review that one.
okay. Because I'm assuming when we get to that, number 10 is gonna have to, no, not number 10, number 11 is
Yeah.
gonna have to be removed,
I was in a big hurry because
yeah.
Cheryl literally got back to me about 10 minutes before I left to come to town hall.
Yeah, cause 11 under conduct and procedures is the same as 7D under, the public comment
Yeah,
policy,
so
so,
it will have to be changed.
yeah.
So I guess what we do now is, first of all, we ask if any board member wants to change anything or has any comments about, as you see it before you with 7D removed. Have any comments or concerns or suggestions about the Board of Health's, public comment policy?
I like it.
Yeah. Do you have any ideas or thoughts?
No, I'm wondering, like, when you know that it's going to be a topic that, is emotional, I guess, for a lot of people, do you ever invite like public safety to come sit in, or?
We've never done that for the Board of Health. I
I've
don't
never
think.
done that. The select board has done that.
Yeah.
When they knew that a topic would be controversial.
Yeah,
But we've never done that. It's always at our discretion, if we thought that that would be necessary, we would certainly reach out to public safety and so on. It could be here, but, they've always, they've never
Yeah.
had a.
My wife actually asked me about that, and she said, well, what would you do if somebody started becoming physically violent?
yeah, well, I was
I said,
thinking.
well, in that case, we would immediately
Call 911.
call 911 and get the police.
Yeah,
I could hear, like, when we were talking, like, some rustling behind me, not to say like I was worried about my safety, but I was thinking like my back. Personally, my back is towards them, I don't know what's going on, I can't really tell. So if something did go awry, it would. This isn't really a conducive setting for.
No,
you know,
it's not.
Yeah,
I mean, I have seen police attending routinely the handicap meetings, because that does get pretty nasty at times.
Meg, we can move you over there.
yeah, I know, I can sit right next to the door, I'm not.
I mean, it's a good point though, that's a very good point, and we do have people that sit there, so
Yeah.
I think there's certainly space, we could move all the wires
Yeah,
and you could
it
have,
is a good point, like,
Yeah.
I would have never thought of that. until
Yeah.
you
yeah,
said it.
absolutely.
Because who is missing from our group today?
Lorenzo.
Lorenzo and Deb, and they usually
Lorenzo's
always,
remote and Deb
Yeah.
couldn't come.
yeah,
Yeah.
and Deb's usually remote too.
Yeah.
Yeah. So yeah,
So there's-
next time. we'll
Alright.
do it.
There probably
Yeah.
will almost always be an extra chair, so, I mean, I agree with you. I've heard those concerns at home. Like, if you're bringing up something that is going to be extremely emotional and people are going to, not listen to what you're telling them that they should do. And then they start fighting with each other verbally, and then they get abusive, and somebody gets up and
Yeah.
says, I'll show you.
I can see that happening, especially if there's the neighbors or, people. Yeah, I can see that happening.
I can see that happening too. I hope it doesn't. I've never seen. I don't think I've ever seen that happen in any meeting here in Plymouth.
No, I've been in town, and I've also been in town politics, I'm a town meeting member, and I've been in all sorts of committees for like 20 years, and I've never seen it happen. Yeah, but that's an interesting point, town meeting
Mhm,
always has a police officer,
mhm.
Yeah.
always has a police officer stationed there from start to finish,
Yeah,
yeah.
I mean, it could happen in other settings too. There's always police at the polling stations
Yeah,
Hmm.
yeah, yeah,
Mhm.
yeah,
for the same reason, I assume.
yeah. Politics can make people very angry.
I mean, if you go to a political rally,
Mhm.
and we've had plenty of those in Plymouth. There was a big, demonstrations down by the waterfront. And there was back and forth because some of the people were like vehemently opposed to the other group. And the police were there, and there was multiple police cars, and one of them actually brought the canine unit with them. And they were ready for whatever happened. And, you know, they actually, it broke out, it got so bad that it ended up being fistfights in the middle of the street on a water street.
No, I'm aware of some heated, Board of Health meetings on the Cape, you know, especially if there's businesses involved.
And we have had one instance where there was, one person present and as the meeting was getting started, somebody whispered in my ear, she could be trouble.
um,
And
Well-
yes, she would not stop talking,
yeah,
despite whatever warnings we gave her. But now we have a procedure which is legal to use, and we will use it if we have to. Hopefully, we won't have to. Lorenzo, did you have anything you wanted to add or change on the public comment policy?
Through the chair, no, I read this and I guess you're gonna strike some things out based on Cheryl's recommendations.
Yes, 7D is going to be removed.
Okay. No, I think this is great to codify this. So I'd be very supportive of it.
Okay,
so can we take a
so
vote?
we can ask for a motion to adopt the Plymouth Board of Health public comment policy with
Yeah.
the provision that 7D shall be removed because of legal considerations.
Mhm.
I'll make that motion.
Amy makes the motion. Is there a second to the motion?
One second.
Dr. Reed, as always. It's the motion. I assume there's no further discussion, so I'll just call the roll of those who are present. Dr. Reed, yes or no?
Yes,
Amy, yes or no?
Yes.
Lorenzo, yes or no?
Yes,
Meg, yes or no?
Yes.
Myself, yes. So when you fill this out, the effective date will be, I guess, today's date.
Mhm,
And the Board of Health will be 5 in favor and none opposed.
mhm.
And we can revise it if we have to. By just looking at it again.
All right, great, thanks for doing that.
So the other thing that, probably there's no point in going through this now, but, I added the effective date stuff at the top again, because we never voted on this either. But I'm gonna have to review this once again and send it to Cheryl for, legal analysis before we can take a formal.
Oh,
vote
the
on it.
conduct and procedures?
Yeah.
Yeah, okay,
So I don't think we can
Yep.
do that today.
No.
So that takes care of that,
that
and
was good though, we got that done.
I gotta get out of this so I can stop the share and then we can go back. There we go. Okay, so, now it's director's report time.
Okay. Very some serious things tonight, but we've already talked about with, Dr. Poppins' report, but, the first thing again is tips, but we've already talked about that, but. The state is encouraging us to keep, posting this information and talking about this information. And then the second thing,
And also Blake will have a vast amount of information.
like,
He's our expert
I
in
know.
all of Plymouth County.
he's fantastic.
He's so good.
The other important, the kind of, we always talk about ticks and mosquitoes, right? So, we have had our first triple E human case that occurred in Worcester County. There has been a single triple E horse case and 55 triple E positive mosquito samples just for this week from Barnstable, Essex, Norfolk, and Plymouth counties. Massachusetts Department of Public Health has also reported 2 West Nile virus human cases and 247 West Nile virus mosquito samples collected statewide. So the surveillance summary, and this is for week 27, week 28, actually, I should have changed that, which is Sunday, 8/11 to Saturday, 8/17. They've sampled over 6,000 mosquitoes. 247 were positive for West Nile virus, 55 were positive for triple E. 4 mammal specimens were tested. No horses have West Nile virus, but there is one horse that does have triple E. For West Nile virus, 79 human specimens were tested. 2 resulted in positive West Nile virus cases, and 1 resulted in triple E cases. And there'll be a meeting tomorrow at 9 AM, I think, for, all communities impacted by these numbers. And so I'll be attending that meeting because Plymouth County is obviously impacted by these numbers.
We are now at high risk
We're at high risk
for both.
for triple E, not for West Nile virus, moderate scale
Moderate
for
risk.
West Nile
Okay.
virus, yeah. So again, we've talked about this several times too, but again, the state is asked that we keep reminding it's the best thing to do is to be prepared and know your risk. Wear long sleeves and long pants, as Dr. Poppin referred to. No one's gonna wanna do that, but it is getting a little cooler, so maybe it's okay to wear long sleeves and long pants. Use mosquito netting, mosquito repellent, especially between dusk and dawn. Dump standing water, really take a look around, see what you have, on your own property, unused swimming pools, wheelbarrows, buckets, if you're gardening, don't leave anything like that with freestanding water. It's just an attraction for the mosquitoes. Also, going on to rabies.
Well, before you go on to that, I think it's important. I also noticed that at least the mosquito that carries Ixin equine encephalitis tends to peak in population numbers in August and September. After that, it starts to decline. West Nile virus mosquitoes apparently last much longer. And for those that think, oh, there's just hardly any cases, I'm not gonna worry about it. If you are unfortunate enough to get this disease, triple E, I believe, has a 50% lethality rate.
It's horrible.
And those that survive usually suffer neurological damage.
The worst headache you ever had in your life.
And mosquitoes will be around till a true first frost.
Yeah.
So it's
Yeah.
important that we stay, very aware and do the best that we can to be prepared and know the risk. It's also the time of year, again, September and October, I wanted to bring it up, that the rabies baiting project takes place. And that's when, bait traps are set. But the bait stations are set up. And it's a vaccine. It's actually targeting raccoons, fisher cats, opossums, skunks, coyotes, foxes, river otters, and woodchucks. If you happen to find a vaccine, and there's a picture of them right there, use a glove or towel to pick it up, throw it into the woods where children and pets will not find it. If no suitable place is available, you can dispose of the bait in the trash. Wash your hands thoroughly after handling the vaccine and bait package. They're usually put in remote places, but what happens sometimes is animals will pick them up and then drop them off some other place. So if they are moved, then they become visible. If your pet has eaten or had contact with bait, it's not harmful to them, but please report it. And I have the coordinator's name and phone number there. And if you or any other person has had contact with the liquid vaccine, which is in the trap, the bait station, then wash the area thoroughly and call the Department of Public Health at that phone number to let them know that where you've done that. Then are some of our personal Plymouth cases, which we can talk about. Lyme 49 for July, flu 21. Our COVID cases, this is again for Plymouth, the town of, we had 91 in June, 166 in July, so there's the spike. And 76 to date this month in August.
And those are ones that the doctors have reported.
That's correct.
Yeah.
Who knows? Really, who knows how many are taking the self-test and just doing what they need to do on their own. These are either hospitals or medical professional offices. Cyanobacteria, we're doing better this year than we did last year, which I'm pleased with. We just have one advisory, that is still Clear Pond. it has been an advisory status since June 24th, but it is not cleared, so it's going to stay in advisory status.
Does that surprise you with the very, very hot weather and the rainy conditions?
Yeah, I'm thrilled,
Yeah.
yeah.
So they were expecting the opposite to happen.
Absolutely, so I'm absolutely
A
thrilled.
lot of
with-
beaches are being closed.
I was gonna say, that's what we're saying, seeing even our saltwater. So, but again, all of our beaches are tested, every week, and happy to say that all our beaches were testing fine as well. And then finally, we are welcoming to the town of Plymouth, Casey Kennedy, who is our new communications coordinator for the town of Plymouth. So I mention this because, we are requesting that all media inquiries go to Casey. So if any of you get phone calls or emails, the town manager is requesting that they all go to Casey, just so it's a united format, the voice is the same. Of course, she'll reach out to anyone to ask for a soundbite or a quote perhaps, but we really want to start it being that, any media outlets go to Casey, and I gave her, email address there as well. And she's gonna be the person responsible for updating, the town's website with, banners for things that are important. Anything that's coming up, things that we might have through public health that we want people to know about right away. If we ever did have a beach closure, that would be something I would reach out to Casey for. She would put that on the website as well as probably do a press release.
So Karen, if somebody reached out to one of us, we shouldn't speak to the press until we go to Casey.
Correct.
Okay.
Yep,
Just
like
confirm.
Casey kind of start the process, and then
Yeah.
of course she'll reach out to you if she wants a quote
Yeah.
or something like that,
Yeah.
but it's just,
Yeah.
we really want to be funneled
Yeah.
into that one person.
So we get a call from, somebody that says, hey, what do you think about this? And I say,
Yeah.
oh, let me check in
Yep,
with our.
same with me, someone calls my office or sends me an email, it goes right off to Casey.
Yeah.
She's come back to me and asked me for
Yeah.
additional information, or, do I wanna add a quote to her little blurb, whatever the case might be. But it's important that we at least start, with Casey at this point, and she's fantastic. Hopefully, maybe I'll have her pop into one of our meetings so you can meet her, she's really great.
So case in point, I've gotten a number of calls from various people at Plymouth Independent.
Oh, send them right to Casey.
And they just want information.
Yeah.
Which I do have access to,
Yeah,
but rather than give them information directly, I should send them to Casey, or I should answer their questions and also refer them to Casey.
no, you should refer them to Casey, and actually Casey's going to be meeting with the Plymouth Independent and with WHED and with, Old Colony Memorial. And I'm trying to think what else, to introduce herself and establish a rapport so that they'll become accustomed to reaching out to Casey. You know what I mean? And then have Casey sort of be the team captain, who then reaches out to you and says, well, Dr. Coffin, the Plymouth Independent wants to know about COVID cases, what's happening with COVID? You know what I mean? Well, this is what, is happening with COVID, and then I can say, oh, Casey, here's our most recent numbers, things
Okay.
like that.
And same thing with WHED, because Bobby often asks me to come to her house.
And I mentioned Bobby Clark to Casey, and she'll be reaching out to Bobby.
And I think you've been over there, right?
And I have been over there too, and it's a lovely spot, but I think it's important that it's a consistent message. And so that's why we're asking that everything would go to Casey first.
Okay, but the non-media things that come up, we often get, or I often get messages by email that obviously need to be directed to the department.
That's okay,
That doesn't need to go to Casey too.
no, that's okay, because then
Because we would flood her if that happens.
yes, yeah, no, that's fine. But that's my report for today.
Okay. Only thing I needed to announce in addition to the upcoming visit, and I believe our next meeting, does somebody have a calendar handy?
September 18th.
Yeah, September 18th, Blake Dinius will be coming. And I'll set aside probably a good half hour for him, because,
And then Devin's gonna be doing her presentation.
and Devin will be doing a presentation about the incredible data, which includes demographics as well as, stuff that came off of Maven and non-infectious diseases. and obesity and diabetes and this goes on and on.
Yeah,
on
and the best, I think the best part about that is the data is from 2023,
Yeah.
so it's not, 10 years old. It's actually very, very recent, so I thought that was pretty exciting.
There is one exception,
Oh, yeah, it was
the
always.
cancer data.
Yeah, I know.
Is the,
I should say some of the data, some of the data is new, and that's exciting. Some of it is.
Yeah, cancer incidence data from the state goes no further than 2015, which is causing all kinds of problems. And it actually diminishes what Devon can do.
Mhm.
I mean, my argument is that we need to know about cancer data in the towns. We need to know what kinds of cancer cases have popped up. So that we can start to decide, are there clusters within our town?
Right.
If there are not clusters within our town, what is causing the increased number of cases and what can we do about it?
Mhm.
But if we don't know what's going on in our towns or even parts of our towns, we can't do
And
anything.
if there are clusters, what is in that area that could be contributing to the cancer rate?
Yeah.
Mhm.
And that's part of health equity, because, people that live in less well-off areas of town often suffer a lot more from health issues.
I can't imagine that Dana or someplace doesn't keep that.
They keep it only for their own patients.
Yeah.
I mean, if you look at the Johns Hopkins website, because I do. What you can find, especially it happened during COVID, you can find information for counties. But
It's very county driven.
you cannot find information for each individual town or city.
And I talked to the state today, and it's interesting, that's a conscious decision on the state's part. And they say it's for confidentiality, that the data is county driven, not town driven.
And suspicious things do happen because I was told that one of the epidemiologists out on Cape Cod that I have also had contact with, all of a sudden, I guess, told Devon that the cancer incidence data was updated and now it goes through 2020. So of course, I ran to the computer instantly
Yeah,
to look and it wasn't there. And
I
so,
can get into that. I
so,
know who you're talking about.
Yeah. so Devon called the epidemiologist and she's got a group of epidemiologists she actually consults with all the time.
Mhm.
And the woman who saw it up in the updated version says, yep, it's gone.
Mm,
interesting.
Very interesting.
You can draw your own conclusions. I have
Yeah.
not.
Yeah.
Ooh.
Do we need the detective?
I would
get
be,
a little
I would
detective
be,
hat
please
and
let.
Work.
So if there's nothing else for new or old business,
No,
nope,
I'll make a motion to adjourn.
okay,
and I will second.
okay. There's a motion to adjourn. Is there anyone who wishes not to adjourn? You can vote no. And you can explain why you want the meeting to continue.
Well, probably be able to.
But I will call the roll. So the same as always, Dr. Reed,
Yes.
Amy,
Yes.
Lorenzo,
Yes.
Meg,
Yes.
myself, yes. Good evening.